Last night, there was a panel discussion regarding the economics and logistics of Theranostics. Matt Shah, senior executive at Siemens Healthineers, and Terri Wilson, president of Blue Earth Diagnostics, were part of that panel and join me now. Welcome. What were the main themes that came out of the panel on best ways to ensure new Theranostics get to as many patients who need them as possible?
So what we heard loud and clear yesterday was embracing the work with other specialties. So there's going to be a significant influx of patients and becoming comfortable working with some of the other specialties, and also being more comfortable with the patient management itself. This is going to be an inflection point for nuclear medicine.
I think one of the main themes that came out is the need for education and awareness about new radiopharmaceuticals and new radiotherapeutics. It's educations not just of patients, but also awareness among referring physicians, whether it be the radiation oncologist, the medical oncologist, or the urologist, in terms of just making sure that some of the outcomes results from the newest therapies are available.
What lessons can we learn from the past about clinical therapy adoption?
Yeah, I think we really need to focus a lot more on the value that we're creating and the patient outcomes, rather than be focused on the cost side of the house. And also, I think it requires convincing the government, CMS, and the private insurers on the value and more importantly, the actual sort of patient outcomes and the difference it makes in patients' lives. We need to be able to clearly demonstrate that.
Absolutely. Preparing for the radiopharmaceutical therapies through awareness, education of all the stakeholders. One of the challenges that we see a lot is reimbursement. So ensuring that we are working with the payers, both the commercial and the government payers, the legislators, and the patients, making sure that the patient advocacy groups are aware of the value of nuclear medicine, that it's not a last option, that there may be benefit from using it even earlier in their disease progression.
What training is needed for these new therapies for nuclear medicine professionals?
Managing the patients. The diagnostic patients, there's a very low risk of side effects, whereas with a therapeutic patient, there is a higher risk of the patient having a side effect or needing some more consult from the nuclear medicine physician. The other piece that we heard was that we need more nuclear medicine physicians who have the infusion rooms, who are able to provide the therapies in their facilities.
Yeah, I think some of the new training that healthcare providers will need is sort of new tools that really sort of help understand the maximum tolerated dose that you can give to patients in a treatment plan, and also sort of at the same time making sure that there's no adverse unwanted side effects. So I think this is the balance that the healthcare providers will have to figure out. And there'll be new tools such as dosimetry tools or AI tools that will help in that. I don't think they're a prerequisite for administering those therapies, but definitely will be a significant tool that will help the physicians.